This is our fourth Instagram Live this week, the fourth. I'm so excited. We have had so much success with our Instagram Lives. In this week with Ask Us Anything, I have a very special guest. Her name is Lauren Haring. She is a former fertility nurse, and she's created a company called Embrace Your Fertility or Embrace Fertility, and her handle is uh, at Embrace Your Fertility. And I'm going to connect her right now. We have so many awesome things to talk about today. And some of the things that she covers are things that you don't necessarily get at the IVF clinic. For sure, you're probably not going to have time with your OBGYN to cover some of these topics. But today, it's really about lifestyle and fertility and some of the things that you can do at home to optimize your outcomes, whether you're doing this. Hello, 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 my friend Lauren.
Hi.
How are you?
Good. How are you?
I'm doing well. I'm doing well. So for everybody to introduce Lauren to the world, I was just telling her she must be practicing what she preaches because her skin looks so beautiful today. I was noticing how milky white it looks. It's beautiful. But
Thank you.
you divulged and said you don't always practice what you preach.
Yes, do as I say, not as I do.
But you have such an interesting background, and I love how open you are about your journey to the fertility field. So can you actually just take people a little bit through some of the, broad strokes of how you got into this field, how you've been able to serve people in multiple different types of capacities?
Sure. Yeah. So my introduction to the fertility world was actually when I was in nursing school. I was looking for some help to pay for nursing school, and I happened upon egg donation. And I absolutely loved the nurse who took care of me that I said, I want to be you. I want to do what you're doing. And I just knew that's where I was meant to have, my nursing career. And so I basically went straight out of school into a fertility clinic, and I was at the same clinic for over 15 years.
Amazing.
And it was so hard to leave, to tell you the truth. That's my fertility family. But I did see this need for more of an integrative support for the patients that were coming in. And I wanted to try to help bridge that gap and give them a little bit more personalized fertility care while they're either trying on their own or going through fertility treatment.
Which I love. And also the way that you set up your company and how you practice in this kind of new way, it's perfect for this day and age. People can be at home, you can connect with them online, right? It's a whole virtual care practice. And I think that that's really incredible as well.
Yeah, I was very fortunate that I actually began my practice virtually before COVID hit, but it works out very well because everybody's safe. We can still talk as often as we need, see each other just like we are. In fact, I love when I get to actually see my clients, because everybody craves being seen these days.
I agree with that completely. So I want to say hi to a few folks. So we have Gitana 22, V Fuko, Fertility Within Reach. Hi, Davina. At 1985. Always love having you join us. Coach Avi, Michelle, Pichardo La Rosa, Dina, or Deanne, Dira. I hope I'm saying these handles right. Hi, Soul, Frenchie. This is great. It's so good to see everybody. Calcoretta, Millemia, Marissa, twice. Okay. She waved back. Thank you. Let's see. And Siren, I think, or Serenia. Oh, that's beautiful. Okay. Kate Myers, Monica. Oh, good. Mr. Surab. Lauren, you're there too. Another Lauren. Lauren ECH. I feel like you're in my living room these days, Lauren ECH, because you're on all these lives. So I feel like I know you so well already. Patricia, Sumai, Gabby, Momco, Kelly. All right, Kayla. Great. All right, we have some questions starting to come in, so we'll get right to it. So we definitely know infertility is a disease, but it's not one that we want to say, I'm infertile. We don't. I think that there's something that's really difficult for all of us to kind of identify as that. I'm a cancer survivor. I have iatrogenic infertility. It was caused by chemotherapy, but our lifestyle choices can impact it, whether it's genetic, whether it's not genetic, whether it's caused by a condition that then leads to infertility like mine. And I think that we talk so much about like a helplessness and a lack of control. And I think that one of the best things that you do is give people back that sense of autonomy, because you kind of come with this like list, but here's all the cool things that you can do. And some of it even includes like putting romance back into the relationship, right?
Absolutely. Yes, that's key. Yeah.
So where do we even start? So let's actually start with where the places are for both genders that people can turn to make the most effective changes.
So, male and female, both genders can absolutely benefit from making some minor lifestyle modifications that can just positively boost their natural fertility. So, in this world where so many things are out of our control, politically, medically, I'm not even going to go into all the different ways. This is something that we can actually make a specific choice for ourselves, and then we can actually choose to understand the things that we put in and on our bodies affect not just our general health and wellness, but specifically fertility, health and wellness. And they are directly linked. So it's really important to be conscious and aware of these things that you're doing so that you can maybe make a slight change in one or two places here, one or two places there, and they add up. And over time, you're going to boost your fertility from within.
So as a, for instance, maybe get rid of soda, but you don't have to cut out caffeine completely.
Right, exactly.
Or switch from plasticware to glassware.
Yes. So there's a lot of different areas where we can focus on. We could start with the nutrition and hydration. A lot of people do talk about the different nutrition areas, but bottom line, kind of across the board, that's very similar, is that people do want to aim to get lots of fruits and veggies, at least 5 to 7 per day. If you can, organic when possible, but make sure you're always washing it off really well to help, make sure you're avoiding any extra toxins or chemicals that you can avoid, so that those types of things aren't undermining your success.
Yeah, I love that. Sure.
Yeah. And then you want to avoid all those processed foods, refined foods, fast food, which is so helpful these days. Everybody's tired of cooking. Gives you
reason to get in the car too.
For sure. I know. I have to think of reasons to actually go in the car these days.
Exactly. But, I know.
It is definitely important to be aware of what you're choosing to put in your body, because you're fueling the ability to create life. And that takes a lot of work. And so you need to be at your most optimal.
I love that. Let's just say that again. You're fueling your ability to create life, and it takes a lot of work.
Yeah.
And for those of us that maybe have the chips stacked against us, it's even harder. And we have to look at it like that, like we're fueling. So before I go back to my list of questions for you, I'm going to kick off to Jay, who asked a great question. So how do fertility meds commonly affect women with mental illness like anxiety and depression or ADD, especially if you're not supposed to be on your normal medications that you take to manage those conditions?
So it's a very good question. Ideally, it's so important to make sure that anybody who's helping you achieve pregnancy or taking care of any of these issues in your life and prescribing medications is aware that you are going to be getting pregnant, because they can also prescribe, it's sort of a risk benefit. They can prescribe a medication that may have slightly less risk for birth defects, and is better to help manage your other concerns, but hopefully won't be kicked off into high gear by some fertility medication. But your fertility specialist, whoever is prescribing that medication, should also be aware, because they do know which medications are safe during pregnancy too. Right. And so they can advise, look, if this certain medication is not as safe in pregnancy, but your prescribing doctor is saying that it is absolutely necessary and the benefits outweigh the risk, then that's something that's going to be important to make sure everybody's just aware of and on top of together. So it's definitely possible to continue those meds or maybe slightly adjust them while you're taking fertility medication as well.
And usually it's like first trimester that's the most risk, right? So I remember I tried to stay off of my anti-anxiety medication during first trimester with my son, and I did safely go back on it during second trimester. And I just had this conversation with my OB yesterday because I'm gearing up for another embryo transfer. And so I am on also an anti-anxiety currently. And, I don't know how anybody's gotten through like this year of quarantine without some extra help. I keep telling everybody, This is not the year to be heroic from your mental health perspective at all. And, this offers us like the best type of, stress support even,
Yeah.
and we just had the same conversation, Jay, around, hey, what is safe for me? Should I transition into a different classification of meds now, while I have like the next 2 to 4 weeks in front of me to kind of make the adjustment? I will tell you, Jay, from my own personal experience as well, when I did my egg retrieval, it was when I was going through cancer diagnosis, and I was kind of in this window of just having a ton of stress related to the diagnosis. So the meds didn't impact me in a negative way at all. I actually felt so empowered because I was stimulating life force. I was doing something to me that was proactive, whereas the whole medical community was doing things to me, that they had to do. And so it was a really beautiful time for me, and I didn't have any issue. Now, some women who do back to back cycles have an issue with like, hormones high, maybe heightened emotions, anxiety, or sort of exacerbating regular symptoms of anxiety and depression, and then maybe a crash. If you're closely watched and in close communication with your whole suite of doctors, whoever is your therapist, whoever prescribes your medications for those conditions, and your fertility nurse and your fertility doctor, I feel like you've got a lot of great people around you that you can cope no matter what you feel like your individual reaction is. I have heard from most people, it's the drop off after an egg retrieval that's the hardest, because you go from lots of hormones that can make you feel tingly and happy to like zero after that trigger shot. And so that part for some people who do have anxiety and depression can be hard, but it's also really important to remember that it's all temporary. Like your body will go back to whatever its normal status is, right? And you should be able to adjust, no problems. I hope that you find that helpful, Jay. Let's see if some other ones have come in. Hi, Oh, I like that. Giggles. That's cute. Leslie G. All right. Jenny. She has PCOS. She's trying to have a baby. When you normally have somebody, Lauren, who has PCOS, what are some of the lifestyle modifications that you recommend so they can kind of exhaust the at-home modification route before they have to go the assisted route?
Right. Yeah. Well, so there's several different areas I consider that are wellness pathways for fertility. And the one that, regardless of somebody who has PCOS or endometriosis or some other issue, one of the things that everybody needs to be aware of is to get good quality sleep. Sleep is when our hormones reset. So many good things happen when we sleep. And it's really important to get just that basis of the 7 to 8 hours of good quality, not 3 hours here, get up for a while, come back, go up and down all night long. That's something really important that everybody can do. And it's free in your own home every day.
What if you have trouble with that? So are you going to come and train my cats to leave me alone?
If I could train my own.
Right. They get me up at like 1 a.m. every day, and I stick them in the laundry room at that moment. But, my son wants to go to sleep with the cats, and then I've got to get up in the middle of the night. But there are a lot of people who have trouble falling asleep and trouble staying asleep. What are some good techniques that people have to fall asleep and stay asleep?
Right. Well, first is to make a routine. Routine is so important in all areas of life, but especially with sleep, getting yourself into a somewhat consistent bedtime. Make sure that your room is ideally not full of distractions, and you've got enough, whether it's room darkening blinds or enough to make sure that you are in this kind of dark cocoon, if that's what you prefer. A lot of people find it hard to sleep in a warm environment. So making sure you've got, this nice kind of dreamy bedspread or whatever is going to make you feel comfortable when second you get into bed. But I'm going to tell you the thing that almost every single person is a victim of. Put down your phone. Our cell phones are usually the last thing in our hands before we go to sleep. And that is one of the, one of the worst things we can do is just stare at our phone all night long, scrolling and all these things. It's
absolutely,
that's something that's really important. Put your phone down, try and read a book for an hour. I was just telling my husband this the other, last night. And, easier said than done.
I understand that completely, but the phone can also disrupt your intimacy with your partner too.
Yes, exactly. Unless you're, sharing funny things back and forth,
Right.
you can use your phone to connect with your partners throughout the day, send them cute, funny messages or sexy little texts, I miss you, things. But
Sure.
at night in the bed, that's really what the bedroom is for. Two things: sleeping, and the other one, you can tell me what it is. There's really nothing else that should be done in the bedroom.
Got it. Okay. I love that. And you do also talk a lot about like the intimacy in the relationship and how to kind of make sure that romance is not forgotten during the whole trying to have a baby. So is that a hard conversation? Do people open up about that? Is that a tougher? I mean, you and I have done recordings and conversations. We're open about everything, whether it's
Right.
it's true self-care, in taking care of self in the sexuality department, or if it's just, spicing up the romance. So how have people been reacting to you or kind of responding to you? And especially because people are all together all the time now.
Right. Well, I mean, the good thing about fertility is that once somebody does start talking about it and they dip their toe into at least starting to talk to medical professionals, talking about the sex is less scary for them. Just
Sure.
going into a regular medical professional and you don't really know them, and then you jump into a sex conversation, that can be a little uncomfortable. But I found that most people are very open about it. It's just the key is to make sure that the couple is open together. So if they're open with me, that's great, but you need to also make sure, that you're communicating, what are your wants and needs and goals, right. And just in general, as you already said it, infertility brings with it almost, if not equal stress as a cancer diagnosis.
It does.
So
absolutely.
That's not just only on the woman, and often the male partner is forgotten. And so it's really important to just ask each other, how are you doing?
Right.
And then
listen.
What
do you need? Exactly.
Yes. What do you need? What can I do for you? And let me tell you what you can do for me.
I love
because that's, if you don't tell each other what you need or what your goals are, so you can talk, through them, then it's never going to be on the same level. And so there'll always be some form of, what's the word I'm looking for? Just kind of strife, because you're really just not on that same level, and it adds more stress.
Got it. Okay. And Jenny followed up a little bit too. She said, yeah, she has trouble with sleeping. And I wonder how much, and she doesn't have a period. So she doesn't have sort of like, probably the natural sort of rhythms and cycles of cycle, if you will. And, I feel like sleep is so hard, but if you have a metabolic disorder, you're insulin resistant, how can, this might be a question for Dr. Chen on Monday, but how does that maybe impact her sleep quality too? And is there something she can do about that kind of holistically, like avoid carbs or eating 2 hours before bed,
right. Well, so I definitely think Dr. Chen's probably going to have a little bit more in-depth information on that. But I mean, in general, the same things apply as far as trying to avoid caffeine before bed, hours before bed. Don't drink coffee with dinner, at the end of dinner to get that last little boost. Try not to exercise too close before bed, because, that actually is waking you up and pumping up all of your endorphins. And so you want to try to remove all of those stimulation effects that you're getting. But certainly I would hope that Dr. Chen will have definitely some more information about that for her.
Yeah. So Jenny, I do a show with an IVF specialist on Mondays at 2 p.m. Pacific, 5 p.m. Eastern with Dr. Serena Chen. So let's ask her that question too, just about the insulin resistant connection. And if you're already insulin resistant or not, because I would imagine that could make it, I'm just figuring if you had like carbs too close to bed and you have this like rush of blood sugar, not the insulin to metabolize it, right? There's like so many things going on at a metabolic level that to me could make you uncomfortable, make sleep difficult, or make you sweat. I'm a night sweater right now. I like it. I wake up and I feel like I've exercised, and then I get up and I hop on the bike and I do my 20 minutes of exercise. But I'm like, oh, this is weird. Perimenopause stinks. I don't have the hot flashes during the day just yet, but I do definitely have the night sweats. And I'm wondering too, on the PCOS side with the fruits and vegetables, is there anything that you've seen be a real success in your practice, with those who are already insulin resistant? Can they reverse insulin resistance?
So I don't follow them specifically as closely for that. We just go through the basic, fertility boosting ways to go through the whole nutrition and movement and all of those different areas. So with the other more specific, they're still being followed by their reproductive endocrinologist or their endocrinologist, whoever, is focusing on that with them. So their levels and any other further evaluation, I would say, luckily for me, I'm not actually following up with them, but hopefully, they've got that. This is something that's lifelong. So they'll need to have, involved caregivers from beginning until through their pregnancy, delivery, and so on. Yeah.
I love the idea of having like rituals before bedtime. We do that with our children. So those of you who have secondary infertility, that already have a child, it's like the biggest thing with baby care, right? Is get them to routine right away. And that routine stays with them, throughout their life. And I find the rituals, whether it's lighting a candle or putting lotion on my hands. Actually, one of the gals that works on the team at our company, she and her mom have a hand cream line. So I rub it into my cuticles every night. It smells amazing, makes me think of them, and they're full of joy. Or I have like a tea, at night that doesn't have any caffeine, like sleepy time, chamomile or something. I start a lavender diffuser. So I have lavender going.
You're hitting it from every angle.
But it still doesn't work sometimes.
Right.
Sometimes my mind is like crazy. And then I've got a meditation app that has really good sleep meditations. And I'll tell you, this takes such commitment, Lauren. Sometimes I have to do the same meditation throughout the course of the night, 3, 4, 5 times, just to keep, falling back asleep.
Well, and I'm not a big proponent of just popping medicine anytime you need, but there are certain medications or supplements that are safe that can be used.
I love melatonin.
Exactly where I was going with that. Melatonin is pretty benign, but you can use that to kind of just ease that little hump before you get to sleep, or hopefully help you stay asleep a little bit, a little bit better. Of course, 8 does not overpower cats, but it
doesn't, unfortunately. Although I was ready to get some melatonin too. Allison is saying her CET is Monday. Yay! That's so exciting. Although the second part of her statement is sad. So the first ended in miscarriage, which is really that's heartbreaking to hear. I mean, I've had 5 of them, Allison. We have such a community full of people who have experienced loss. And our heart totally goes out to you for that. She was planning to make some changes before this transfer. She definitely spent time grieving, but this kind of snuck up on her. And now here it is, Monday, which is exciting. And she wants to know, is there any advice going into this second transfer?
Any advice? Well, of course, every clinic is going to be different about their medical recommendations, but my best advice for you and anybody else out there is to go into your transfer knowing that you've done everything you should be doing, whether or not you're taking medication, per the doctor's orders, or you're doing a natural cycle. As long as you're following the instructions, taking your medications, your prenatal vitamins, you're doing everything you should be. You've got to give yourself a little break. This is hard. This is hard for everybody. So give yourself a little break and know that you're doing everything you should be. If there was something else that you should be doing, they would tell you. There's no magic pill anybody's withholding, but try not to beat yourself up over, oh geez, I picked up that pen that I dropped on the floor and I was supposed to be on, my 30 minutes of bed rest or something. You're not going to do anything that's going to make this work or not work, short of going through, your actual instructions that you need to follow. So that's really key, because I feel that stress is something we can't quantify how much it affects us, but it's something that we need to manage better. And we put so much pressure on ourselves, especially on transfer day.
I love that so much. And Allison, I was in that same mindset even when I was pregnant. I felt like when I delivered my first child and I did fertility preservation 13 years ago. I did a transfer, gosh, almost 8 years ago now, which is nuts to think it's been that long. And I'm gearing up for my second transfer. And I kind of joked, like I wanted a second chance at pregnancy because I felt like I didn't do anything right the first time. I gave in to every food aversion, every craving. I barely exercised. I was so scared of losing the pregnancy because I had had so many losses leading up to that one. I felt like I didn't even want to move. And I wanted like a chance to do better, And so I totally feel where you're at, Allison, and just want to echo what Lauren said, which is that the miscarriage is not your fault. And if the transfer doesn't work, it's not your fault. The unfortunate side of our field, right? And us accessing this area of healthcare is that it fails the first time more often than it succeeds. Mm-hmm. And that includes with a loss. So I love your advice. And like now is the time for as much self-care as like you can even think and dream of, right? Yes. So like leading up to that, afterwards, and that includes things like acupuncture and massages, go to somebody who knows about the pressure points, right, of loss, but she's, as a follow-up, she's asking like, what are your opinions about acupuncture before and after a transfer? I'm biased because I love it.
I'm biased too. Bottom line, medical literature is going to say it doesn't hurt anything. May help. So why not? If it's going to decrease your stress, make you feel like you're doing something else to make this work, that's the key, and hopefully you are getting a benefit, increased circulation, all these other things that go along with it, but you're making this choice for yourself and it's certainly not going to negatively impact. So it's a great thing. Yeah.
And Dr. Chen and Dr. Raquel, who I do my Tuesday shows with, Allison, they both love acupuncture. And their attitude is, I don't even care what the literature says. It feels so good. It makes us all feel really good and relaxed. So definitely go for it. I don't think that I haven't met an IVF doctor in recent years, and actually in the last 10 years, that would say, no, I'm opposed. I haven't met anybody in the last 10 years that would say that they're opposed to acupuncture. I think that the benefits are still the thing that people debate about, right? But there's no debate about how it's used for pain management. There's still just this debate about whether or not it improves egg quality or whether or not it improves circulation enough to the uterus to make a difference. But we love it. Serenia, am I saying that way? Because I'm saying it correct, because I really love that. If I'm saying it right, I really love it. But I also like it if I am saying it wrong. Serenia. All right. How much caffeine can be consumed when you're trying to get pregnant? Such an awesome question.
Yeah. And honestly, that's one I get a lot. Basically, about 200 milligrams of caffeine a day is what's allowed. And
is that a cup? What's 200 milligrams really mean?
It depends on where it depends on where you go. You have to ask, kind of be careful, because you've got your cappuccinos and your espressos, and so a basic cup of coffee typically can be somewhere between 80 to 120 or so.
Oh, great! So I can have 2 cups a day. Okay.
Depending on how strong yours is.
So. Okay, I was going to say, wait, I'm Italian and we make our coffee very strong and very black.
Right. So, probably going to be one, but that's the key is to not overdo it. You don't have to completely limit yourself and you're going to have nothing and go through caffeine withdrawal and headaches and all of that.
Sure.
But, moderation.
Yeah, super helpful. And Real Air is asking another awesome question, which is, how long does it take? I think that she had autocorrect on this, to conceive after hysteroscopy surgery. How long should she wait, maybe? Or how long do you usually see is a good window for people to expect?
Yeah, so that's actually something, it's hard as a medical professional. I always kick back to your treating physician. So whoever did the hysteroscopy should hopefully advise you based on how the hysteroscopy went, if there was anything that they found of any concern.
Post-op report,
Yeah. So typically, if there was everything that was normal, some physicians will say you can attempt to conceive with that very, next cycle. So it really depends on what those results of the hysteroscopy, showed. And so probably best to follow back up with them, for any concerns. But
it sounds like if they said the year, it's not going to be a year.
No.
Yeah.
As long as there's no concerns, it should be fairly quickly that you can go ahead and try to conceive on your own. Yeah.
Yeah, and Real Air last night at 5 p.m. Pacific, I interviewed Dr. Ganala, who's a reproductive surgeon, and that might have come up during it. So if you check our IG lives for expert conversations, or sorry, IGTV, you can watch that episode Real Air, and that question might have been asked. And if it wasn't, and you want further clarification, just as a second opinion, that's a perfect thing to hop on the app, the Fertility Answers app. It's, we're on iOS and Android, and ask that exact same question. Chances are Dr. Ganella will even see it and can answer that question for you, just so that you get that like second opinion and voice kind of into the mix. I think that that's really important. Oh, Ariana's asking a really great question. How does she know if she's ovulated?
So that is a good question. Well, the most definitive way to know is to get lab work done. Yes. That's not always the easiest way, and certainly not always the most cost efficient way. So, just getting an actual period doesn't confirm that you have ovulated. Mm-hmm. And so there are the over-the-counter, some people love them, some people hate them, the ovulation predictor kits, which basically some people have a really easy time using, and some people get extremely stressed out because they can't actually determine if they have a positive on this kit or not. So the most reliable way, without having any extra concern and stress on your own side, would be to go to a fertility specialist or your gynecologist, and they can do a blood test. Typically about 1 week after you would have expected ovulation. Hopefully you have the positive kit at home that you can see and detect that on. And then you get a lab test about a week later, and that blood work is going to actually show a progesterone level, which is the hormone that's going to confirm if you did ovulate. And if you ovulated, it'll also show, of course, what that level is, if it's sufficient enough to help maintain a pregnancy. So the ovulation kit will tell you hopefully that you are going to ovulate, but the lab test is what will tell you definitively that you have ovulated. Mm-hmm.
And we both work with an organization called Uva Life that invented an at-home kind of lab in your bathroom. And it is, what I love about it is that it will tell you if you had that progesterone surge through urine. And you can measure it. You can take it every day. It can show you kind of your, over the course of a couple of months, it can show you some trends. There is a physician portal. So if you have an iOS phone, you can use that. If you don't have an iOS, their iOS app is coming out next year. But we do offer 10% off for that particular kit if you just don't want to get in, or like the timing of your doctor can't get you in at the right time. Because, you have to get in with it in that week window to make sure that you had a progesterone surge if you're not going to get a scan done to see, they can tell that way too. But we love the UVA kit. We've had a lot of success with people saying, like, especially with PCOS patients, because the LH is all over the place all month. We love that instead of just a predictor for people to have that confidence of like, hey, I am ovulating, and I was wrong about the timing, and then they're able to conceive, without assistance. But that is an option for folks. We do have a relationship with them where you get 10% off. So you can go to uva.life, and then it's Fertility Answers 10. So that's fertility.
I have to say, I love that. When I was at the fertility clinic, if I had access to that as a fertility nurse, my life would have been so much different. To have that extra information at your fingertips from your home is so amazing to have. It's just, technology is awesome. I
know. And people are innovating cool things left and right. I mean, I love that this year of all years, right? There's so many good things that have come out of this pandemic where people's adoption of these at-home technologies has skyrocketed. And I love it. I mean, it gives us autonomy, it gives us data. Like, everything is all about the data these days, right?
Right. And staying safe. And it helps you stay safe at home. Yeah,
exactly. My Shasherman had children, but then in a span of 11 years is facing secondary infertility. So outside of just age being a factor, is there anything else that might change after you've had, you've already had some children that could cause secondary infertility?
Yeah, certainly. So there are things that can change with you. They can also change with your partner. So specifically, in the uterus, things can change. And so you could potentially, over a short term or especially a long-term number of years, grow a polyp or a fibroid that might be interfering with an embryo implanting. And that's something that's usually very easy to determine and very easy to take care of if they see it.
Right.
Potentially, there are certain infections or other things that could cause blocked tubes, so that even if you got pregnant before and your tubes were open, or at least one was open before, something could have changed that would have affected that. Sperm parameters are very easy to be impacted by the environment, medications, things like that. So that's another kind of quick test and kind of see where things fall, because that's one of the easier tests we can do.
That's such a great point, though, because so many women come and they're like, something's wrong with me, I can't get pregnant. And it's like, well, let's rule out 40% of the equation first.
Right. And while there may be something with you, there may also be something with your partner. So
we're all aging every day, unfortunately, and there are a lot of things that could go wrong. Yes, exactly. Yes. Oh, hey, Luciana. Hey, Frenchie. Okay, we got some other folks joining. Hi. Let's see, Caitlin too. Hi, ladies. All right, thoughts. Frenchie's asking thoughts on chiropractic work for fertility. Did you see that successfully in the fertility practice, or is that just an area, unlike acupuncture, it has even less data?
So basically, it's like acupuncture and has less data. I had not even heard of it at the fertility clinic. Doesn't mean that, that's only one fertility clinic, but I was amazed when I actually met with some chiropractors afterwards and learned about what they do, and the way that they explained how everything in the body is connected, and how if they do certain things to help, with small corrections, that it can actually help with blood flow to the uterus and the ovaries. And it's like, wow, of course.
Sure. That makes sense.
So I think it's definitely something that's emerging, but it's got a long way to go before we'll even be able to say definitively, with lots of research. There's so many things out there that need research right now.
Yes, so many.
That's the problem.
Especially in women's health, and that is part of the problem. So Leslie G is asking a really great question. Can a C-section cause blocking of tubes?
It's possible if there's scar tissue that develops afterwards, but it's not something you can determine from the outside. So it would need definitely some further evaluation. It is possible. It would have to be something that you would have to definitely get a little bit more evaluation for, so you can see what's going on, the full picture there, but it could.
And the good thing is, Leslie, you wrote in that you're having regular menstrual cycles. So that's a great sign. But she is struggling. If you have ovulation confirmation, or do you have ovulation prediction? Meaning, do you have an LH surge that's predicting that you're going to ovulate, or do you have that progesterone proof that you have actually ovulated? Because you are in that age window where they say, well, you're 32, wait 12 months. And if you have just, trouble, then get right into a fertility specialist at that point. We always advocate, if there's something else going on, if you aren't getting the actual progesterone surge, or if you have PCOS, if you struggle to have the first baby, is the fact that you even had a C-section means something when a ride, the delivery. So we always kind of advocate, the sooner you get in, the better, so that you have all your options in front of you and can just start working through that. And, if there is, one of the things that Dr. Ganala brought up on last night's live is, if there is suspicion that it is blocked tubes, is it something that can be removed that's blocking the tubes? So like in one person's case, it was endometriosis, and it was in a place where a spot of endometriosis needed to be left, because if they removed it, it probably would have regrown scar tissue and been like an exacerbated problem, rather than just managing. They got 95% of the endo out, except this one spot. So, that is something. And Lauren, what are some of the common procedures that she can do to just see if her tubes are open?
Typically that's something that your regular gynecologist can even order, so you don't have to go see a fertility specialist right off the bat, but they can order an HSG, hysterosalpingogram. That's the test to look at the ovaries. It's an X-ray test, and so they do it to look at the ovaries, see if basically they push a little dye in and make sure that the fluid is coming out of the tubes to show that it's open, and it will also check the uterine cavity as well to make sure there's nothing in there that would interfere with a pregnancy. So you'll get more information than you wanted, probably.
Exactly. Now, Bitter Love is asking a great question too. First, she's 35 and she's been struggling for 2 years, and she recently found out she's not ovulating. First of all, Bitter Love, I'm so sorry you struggled for 2 years and it took 2 years to find out you're not ovulating. This is why we love kits like UVA, because it shouldn't have taken 2 years to even discover that. You know, we get so frustrated with the way that the health system works in, you know, women's reproductive health, that it would take you 2 years to find that out. They did find out that her husband's test came out normal and her hormones also came out. Let me see if it expanded normal as well. That's what I thought she would say. So, you know, something else is going on. Like, even though the hormones came out normal, not everything is normal. And, you know, one of the things that Dr. Raquel and Serena always advocate is, well, which hormones did they actually look at? Because, you know, if they didn't look at thyroid or prolactin, inhibin B, even, there's some other ones that if it was the OBGYN measuring hormones, they probably just did the basics. Right. And so I think, you know, at that point, she's 35, it's already been 2 years. Like, let's get you into a fertility specialist to see kind of what else is going on. But there are common things to help her ovulate. If she has an egg supply and she's not in premature ovarian failure, there are some common medications that she could try that are considered low tech, right? Minimally invasive or non-invasive approach.
Right. Yeah. So those are called ovulation induction medications, and common names you'll probably hear are Clomid, clomiphene citrate, and also nowadays more commonly used, it seems, is letrozole. And these are oral medications as opposed to the rest of the fertility medications people refer to, which are injected. And so they're taken typically for a short course, beginning of the menstrual cycle, to help stimulate the ovaries to hopefully produce, maybe instead of just one follicle, a couple of follicles. And hopefully that when either you're trying on your own, or potentially if they recommend doing an intrauterine insemination, then they'll be cutting down the distance that the sperm has to travel. So you're kind of just giving all these extra little boosts to get yourself to ovulate, maybe an extra egg in there, and then hopefully decreasing the distance sperm travels if you're doing an insemination.
So what's the difference then between the ovulation induction and the superovulation?
So ovulation induction, so superovulation is where you're talking about, you worry about Octomom. You know, we're not in the business of making, Octomom every day. So it's a very fine line. You know, ovulation induction, the goal is to have ideally, 1 to 2 or 3 follicles. You know, when you get into 6, 7, 8 with the superovulation, that's when people get concerned and either recommend maybe you shouldn't try to have sex, or maybe we should cancel treatment, or convert to an actual IVF cycle because you've done so well and your body really liked this medicine that, it just over responded. And so we need to do what's safest for you.
Got it. What about the connection between a healthy weight and being able to ovulate as well?
Yeah, so there's a lot of studies, a lot of information out there about weight, and it's hard. A lot of women and men too. It's important for men as well, but it's so hard to not have this huge pressure just strictly on the weight side of things. But rather than looking at, aiming for a specific number, ideally the goal is to get into a healthy BMI, but losing just 5 to 10% of body weight can actually increase the chances of conception and decrease the chances of having complications during pregnancy, because it is safer for both baby and mom to be at a healthier weight going into the pregnancy.
Got it. Okay. And Bitter Love, I brought that up just in case. So those, if you do find out you're struggling with PCOS, sometimes it makes it hard to lose a little bit of weight, just because it's a metabolic disorder. And I think that it's always important, I'm not a size 0 myself, and I'm not at my perfect weight. But it is important to know that sometimes like that 5 to 10% reduction of BMI is the difference between ovulating on your own and not ovulating on your own. Or if there has been a history of eating disorders in the past that it has made it difficult to ovulate, right? There's all kinds of things that could be the cause of non-ovulating or anovulation per the technical term, anovulation. And, what we want to do is just kind of expand your thinking on this so you can go back to your healthcare team or even on the app and ask follow-up questions, ask about, oh, okay, well, here's kind of my parameters. Here's my height, here's my weight, here's sort of my lifestyle choices. I have a bad habit with smoking, or I have a bad habit with, I smoke weed. I don't actually, but I just mean like that might be the habit. And, and really just like finding your team that you can be bitterly honest with, bitter love. I did use that term on purpose, so that you feel safe. You feel safe to admit all the things that might be causing it, because there might be something there that's like a door opener to like, oh, I really can ovulate on my own. I don't need to go the medication route. And I did see that she followed up with, she is trying a letrozole cycle. I love letrozole. It's something used in breast cancer care. What I love about it is that you don't end up raising your actual estrogen in the body because your body thinks that the letrozole is estrogen. So I kind of love it for that. But if it doesn't work, some people start there and then they move on to Clomid. Sometimes they do a combination of things, but you're on the right path. And at 35, yes, she's at that critical window of seeing a drop off of kind of fertility. I hate the word, but of the decline, right? Kind of start 35. And so, but does kind of have that window where she could try over the next 6 to 8 months-ish. But then we would say if after, most people find success after those first 3 cycles, is what Serena Chen always tells us. If it's Clomid or letrozole, you can go 6, but don't go beyond that. So if you don't have success within 6 months of trying kind of the lower tech approach, we just say get in to see a specialist, to consider something like medication with IUI or I. And we're here for every step of the way. It's a reminder to everybody too, we have this new partner that we love called Honeybee Health. It's an online pharmacy. So for those who are not doing injectables, but you're doing Clomid, letrozole, or metformin, they have those medications available. Clomid under their very low cost plan is only $3 a month. So that being cheap, most people's copay. Yeah, exactly. Switching metformin to Honeybee Health usually ends up about being $120 savings as well. Wow. So hopefully that helped Bitter Love and gave you some ideas to think about and take back. Luciana asked a really good question about soy, because this comes up. This has been like an ongoing debate for a long time. Is soy good for fertility? Does having low estrogen change this?
I'm so sorry. You broke up just a little bit, so I missed part of the question.
So is soy good or bad for fertility? And does having low estrogen and no period change whether it's good or bad?
So I think soy, it depends on your body. Soy can be good for some people and it can be not great for other people. And so depending on, the kind of inflammation going on underneath and what your situation is, it can be something that's beneficial, but it can also be something that kind of sort of stirs the pot, so to speak, and creates more of an issue. I am not the best expert on the lower estrogen level. So I'm going to actually have to defer that question, hopefully, to your Monday conversation.
Yeah. So come back on, Luciana, to Dr. Chen's chat, and let's talk about low estrogen on the chat with Serena on Monday. But I think that this soy conversation is a tough one because it's still so debated, out there about whether it's good or bad. If you're eating a plant-based diet, it's a great source of protein, right? And so it's hard to tell people to turn away from it. But I'm a breast cancer survivor, and I just remember like feeling like this is just crazy with the phytoestrogen conversation around soy, and like, you can just like your head spin with the debate on both sides.
Of course.
So, but definitely, Luciana, come back and ask Dr. Chen the same question, or ask it. We do have some fertility nutritionists in the app, so you can ask that same question in the app too, and we'll see if we can get a couple of answers going. We only have a couple of minutes left, everybody, so we're going to try to wrap up. So Brandy's been trying to get pregnant again for a while. She does have a cyst on her right ovary. So how is that usually handled? And also she does have a losing weight. I think that the question is a big question that doesn't have a singular answer, Brandy, about what should you eat to lose weight?
Right. Yeah, absolutely. So it's kind of a several part question there. So the cyst is something that, depending on whether or not it's causing pain or discomfort, you've hopefully had it evaluated to make sure whether it's a simple cyst or something more complex. Sometimes there, the gynecologist will recommend using birth control pills, depending on your history. Of course, it may or may not be appropriate, but to help decrease the size of a cyst. Because the cysts, sometimes they go away on their own. Sometimes they're just persistent and they kind of hang out there. So if it's not complex and there's nothing else, let's say medically, that needs to be done, sometimes just taking a cycle of birth control pills can help to decrease the size or help it go away.
Regarding what you do to get on their calendar anyway, right? So yes. Some clinics who batch their cycles will have you get on birth control anyway. So if you're considering an IUI or an IVF and you do have a cyst that may delay a start date, it usually doesn't hurt to try that approach. But a lot of cysts go away on their own, and it does need to be evaluated so somebody knows, is this size, is it changing? Is it something that we should be concerned about and actually even treat, right? Because in some cases they might say, leave it alone, let's check back next month.
Right, exactly. So that's where you need to really get an ultrasound ideally to see, sorry. You need to get an ultrasound to see, a little bit more information about what's going on before you could even determine what's the best course of action there. Blood work also can determine if that cyst is functioning and pushing up the estrogen level, or if it's a non-functioning cyst. And so there's just a little bit more information that we would need to get for that, certainly.
Yeah. And on the second part of her question regarding what to eat to lose weight, I'm going to ask Brandy, if you haven't already, register on the Fertility Answers app so you can get a free 15-minute consult with Lauren, so that you can dive into that a little bit more, because I think that's such a big conversation. Yes. There's not a clear-cut answer, and it's going to be different for everyone, how to optimize wellness, right? Because there's definitely not a quick fix on the losing weight. So I want to encourage you to book your consult, with Lauren. Because I think that'll probably be the fastest path to success. We're going to close with Real Air's question. Oh, and you're welcome at 1985. I love seeing you on the shows repeatedly. You're welcome, Luciana. So glad it helps. Real Air, what are the steps of IUI? So great.
So the steps, well, it depends if you've actually already been to a fertility specialist. So step one would be to go talk to somebody, my biggest recommendation always is to bring a list of questions with you. I'm the obnoxious person who walks into every appointment with literally a list of at least 5 to 10. I even asked my mom the other day, I said, I'm going to this doctor. Can you tell me any other questions I didn't, think of myself to ask? Because you're going to forget something or get emotional. And so it's important to make sure you've got all that, but you'll have your initial consultation. Typically, if you haven't had any diagnostic testing yet, then they'll recommend some initial testing. Typically, that's going to be a blood test in the early part of your menstrual cycle to check egg quality, along with oftentimes they'll do an ultrasound to check what's called antral or resting follicle count to look at the ovaries. And then they can do a little bit more testing, check the uterine cavity, make sure that the tubes are open, because you certainly don't want to go through this whole process, take medication, and then you find out, your tube's not open. So sperm can't reach the egg. So making sure, of course, all of those things are good before you would get started, including a big part, if you have a partner, making sure that they have their sperm tested. If you don't have a partner and you're using a donor sperm, then that's something actually you would want to think about starting from the beginning, because it's not an easy process to pick somebody, and you don't want to rush yourself through that. But then once all the testing's done, it's kind of like a puzzle. You get all the little pieces of your puzzle together. You'll typically meet back again with your doctor. Hopefully a lot of it's telemedicine these days. And they'll give you your plan of whether or not they recommend a specific medication based off of your results, what that medication, how many days you're going to take it for, and whether or not you would be coming in then for monitoring, blood work, transvaginal ultrasounds a few times to see how your body's responding and make sure that everything is happening at the right timing before they would actually schedule the insemination then.
Okay, great. And then just to close this out, so Brandy, no, heavy periods is not normal. If you DM us, if you register on the app, we can connect you with a fertility coach / navigator. She can help find the best OBGYN in your area for you. But I do want to encourage you to do that because no, heavy periods is not normal and you should not be having to deal with that. And if pregnancy is a goal, we want to kind of get to the bottom of that. You're welcome, Real Air, on behalf of Lauren in that. Hopefully that was clear. Lauren, what can people expect when they get a one-on-one with you, an initial one, and like, do you take people through your program?
So depending on which program somebody wants to go through, I do have a fertility enhancing program, which is about 12 weeks. And we talk a lot, and I've got a lot of homework and things to keep both of us accountable to make sure you're making some changes and that they are working to help you feel better and have hopefully a positive boost to the fertility. But in addition to my 12-week program, I do offer one-on-one fertility support where we spend an hour, whatever you want to talk about. So it could be talking about something you've gotten as a result from your fertility clinic, and I'm not going to give you advice, but you don't really understand what those results mean. So I can help explain, bring a little clarity, maybe suggest some questions to ask. Other people just want to use it as an hour to vent about how unfair it is to be in this place because nobody chooses this for themselves. And so anything in between there, the whole gamut, I try to help basically just break down the complexity of the fertility world because this is nothing we learn about. Unfortunately.
Yeah, unfortunately. That's fantastic. Well, I love your programs. Embrace your fertility. So follow Lauren on Instagram. Make sure you jump on the app, on Fertility Answers. She does a wonderful job answering questions, and you can request your, quick 15 minutes to get to know Lauren, hear more about her programs, and see if it might help you guys. We're always here for you. Don't forget, Monday is Dr. Serena and I do Monday Motivation. It'll be an Ask Her Anything. Tuesday is going to be Ask Her Anything with Dr. Raquel on the naturopathic MD side. And we probably have some special guests next week as well. Always check out our IGTV, and we will see you guys next week. So we're here for you. Let us know what you need. Thanks so much, Lauren, for joining us.